Testing, testing. Belum YouTube. Saya lagi. Rajin. Nah. Dapat. Betul lah. Okay, gue dah buka. Assalamualaikum.
Cepat, kita dah join.
YouTube. Dah.
Coba buka volume.
Saya dah. Tadi ada volume bunyi lagu ya. Dalam telefon. Tu saya dah.
Oh, ada lagi. Betul. Betul.
Ada?
Coba kita masuk lama dah.
Oh, kira clear lah. Webex.
Zali,
Hal banyak gila bunyi tu.
Ya, speaker.
Speaker tu on tak? Hello, hello. Hai.
I can see you talking but your mic is off. Tapi Ashikin punya on lah.
Dah. Dapat.
Dah dengar.
Dengar sih. Kevin.
Yang tu share kah?
Pula share dari situ tak ada nak.
Share dia.
Kat sini.
Kan
Ke ni lagu tak?
confuse banyak bila nak ya nak.
Jadi buat pakai lah.
Ni lagu tak?
Keluar daripada nak ya.
Oh.
Hello?
Dapat dengar kan?
Yes, now better. Not
Nak
ada
betul.
echo.
Okay,
Yeah,
okay.
because audio visual is the same window lah.
Ya, tadi this
Same
one.
chat. Yeah,
Buka.
tadi I think buka sikit.
Ya. Okay.
Cun.
Okay. Ni buka lagu balik tak?
We already have a few participants in the group.
Oh. Siapa nak para partisipan lah?
Faiz, and I think some of the staff as well.
Oh.
Under the attendees, but
Kalau kita kena.
Hmm?
Kami kalau kita dah.
Boleh je.
Kah Unimas dah lah.
Oh ya, Kak Unimas.
Kah Unimas host.
Sembahyang. Terus kenapa Ustaz? Apa? Dengan berbeda.
Apa lagi? Apa tu? Stock production. $1.
Ambil besar kita.
Emas for
Okey. Sedih. Oh, oh.
Oh,
Sudah
banyak tak? Sampai isi. Dalam Zoom ada lah.
Zoom.
Oh. Hmm.
Teams dengan
Oh. Oh, okay.
Oh, sebab Microsoft dah bayar.
Oh,
Microsoft ada subscription. Memang dah.
betul, betul.
Hmm. Ah. Dah clash ah.
Si pasti. So, Cik Sulaiman yang tu di Madah.
Kena orang kita.
Oh, okay. Oh, so kita tukar. BM2 kan preparation dan sana
Tapi
tu.
tidak ingin benda. Pokoknya
Asalnya kita BM2.
Saya Cik Sulaiman tukar ke situ sebab
Oh. Jadi tidak ya. Ya, confused lah.
email. Si orang nak ya WhatsApp. Pasal Mek dah nanya lah permohonan baru si di Madah si payah.
Okey lah, dia dah.
Ya dah maklum lah katanya. Sudah masa nak ambil tempat dulu lah.
Maksudnya si macam mana? Dia nak yang kedap.
DM juga.
Sinya nak BM.
Oh, BM.
Dengan BM-nya aja. Kayak.
Oh,
Saya dengar BM mau 33. Saya macam miss.
Dah dibuka.
short attention span lah.
Kan, si macam miss.
Short attention span lah.
Macam miss.
Short attention span.
Oh,
Hi, good morning, everyone. So we have already quite a number of participants joining. So for those who are here in the webinar with us now, For the Unimas staff, please scan the Unimas QR attendance. And for all participants, everyone here, please fill in the link that is available in the chat panel, which is at the bottom right of your screen. This is to get your details for the e-certificate. Right, everyone, please fill in the link that is in the chat panel. You can access it, which is with the button at the right, bottom right corner of your screen. We'll begin shortly. Hi, good morning. And once again, welcome to the audience. We will start in about 5 minutes time. Just a reminder, for all the Unimas staff who are attending, please scan the Unimas QR attendance. While for those who are not from Unimas, please fill in the link that is in the chat panel. This is to get you your e-certificate later. All right, fill in the link in the chat panel for those participants from outside of Unimas. Hi, good morning, everyone. It's me here again. Thank you for joining us. And just again, there's a last housekeeping announcement for those who just joined us. Those who are you who are not from Unimas, please fill in the link that's in the chat panel. All right. So good morning, everyone. Welcome. Today, we gather for this webinar, which is held in conjunction with the World Hearing Day 2026, with a theme from communities to classrooms, hearing care for all children. This webinar is organized by the ENT Department of Unimas, Hospital Pengajar Unimas, and also Sarawak here. My name is Kevin Ng, and I will be your moderator for today. Hearing is essential for child's learning, communication, and overall development. However, in our communities here, many children experience hearing problems that often go unnoticed. This reminds us that hearing care should begin early and reach every child at home, in the community, and in the classroom. Today, we are very honored to have two experienced speakers with us today. We have Puan Ashikin, a very experienced audiologist, and a very senior lecturer and ENT surgeon, Dr. Hanzali, who will be sharing their knowledge and insights on this important topic. So, to kick things off, we'll begin with a few opening remarks from our head of department, Professor Tang Yin Ping, who is currently attending another conference. For those of you who know him, he's a very busy man, but he recorded a message to share with all of us here today. Let's play the video.
Good morning to all my friends and my dear colleagues, family members, and also who attend this webinar. Thank you so much for joining this webinar. So this year, the theme for World Hearing Day webinar 2026 will be for communities to classrooms and hearing care for all children. So this not only remind us the hearing health does not only start in begin alone in the hospital. So you actually, can go into the home, into communities, and also continue in our school, anywhere in the communities, because everyone deserves to hear, okay, to learn, okay, with hearing and using of verbal communications. So today's event is a platform for sharing, and also for learning, inspiring actions, so that giving the opportunity to everyone who is attend this webinar to have strengthen the partnership between all these healthcare providers, educators, family members, and also anyone in the communities. So thank you so much again for joining this. So not to delay anymore, I'd like to formally to officiate this World Hearing Day 2026 webinar. Thank you so much. Good morning.
Okay, thank you, Professor Tang Yin Ping. So it is my pleasure now to introduce the first speaker for today, Puan Ashikin. Puan Ashikin binti Asa is a clinical audiologist at the Faculty of Medicine and Health Sciences, UNIMAS, with over 5 years of experience. She is actively involved in clinical service, research, and also outreach initiatives. Please join me in welcoming Puan Ashikin.
Assalamualaikum and good morning, everyone. Hi. Well, first of all, I would like for you guys to imagine a boy sitting quietly at the back of a bustling classroom. The teacher calls his name once, twice, but there is no response. Some may think that this child is not paying attention, or maybe he could be daydreaming. But what if the child simply did not hear? My name is Ashikin, and I'm an audiologist from Faculty of Medicine and Health Sciences, UNIMAS. Every day, I meet children who are often misunderstood, not because they are not trying, but because they are actually missing pieces of sound around them. So, in conjunction with the World Hearing Day 2026, with the theme From Communities to Classrooms, Hearing Care for Every Child, it is with great pleasure for us to organize this webinar because every children deserve hearing care, irregardless of race and nationalities. This talk is about recognizing those small signs of childhood hearing loss that can make a big difference in a child's life. When we detect hearing problems early, we don't just improve the hearing. We are actually changing a child's ability to learn, communicate, and connect with the world. By looking at a global perspective, currently there are 34 million of children lives with hearing loss. And actually, near 60% of the childhood hearing loss could be prevented. Hence, we have an urgent need to lower the burden of childhood hearing loss. So, why are we so keen in making sure that our children can hear? This is because hearing is the window for speech, and language development. Our hearing matters because it allows us to form sound recognition and imitation. Our children, they learn to speak by imitating the sounds they hear around them. They will start to babble and gradually form words and sentences by copying the speech of those around them. So this process, it begins in infancy, a period characterized by rapid auditory development within the first 3 years of life. The first 3 years of life are the most intensive period for language acquisition because the brain is forming neural pathway rapidly. Dia macam iklan susu yang kita selalu dengar dekat TV tu, masa tu sel-sel otak sedang berhubung. So, language development is best stimulated by conversational turn through parent and child interaction rather than just the child overhearing language. And there's a study that shows early vocabulary at 24 to 36 months of age is a strong predictor of later reading skills, academic success, and also social competence. Apart from that, our hearing allows us to form language comprehension, which is it allows us to understand language, kefahaman bahasa. So before children can express themselves verbally, they need to understand language. So hearing allows them to process verbal cues, understand words, and also understand the nuances of language such as the tone and rhythm. So this is why your toddler yang macam 1 year old tu, dia boleh faham kalau mak dia dah nangis dah. Sebab dia faham, dia mak marah. So this understanding, the language comprehension is essential for the development of both receptive, the understanding part, and the expressive, the speaking part of the language skills. Next, hearing allows us to form social interaction and cognitive development. So through listening, our children learn to engage in conversations, understand social cues, and respond appropriately. It aids in the development of attention, memory, and problem-solving skills, which all of this is important for learning and using language effectively. So, all in all, hearing well is learning well. So the parents might think, what can cause the hearing loss? So there are few factors that contribute to childhood hearing loss. The first factors, it might be happening before the birth itself. The causes could be prenatal infections and genetics. As for after birth, it could be happen due to jaundice and postnatal infection. As the child grows up, noise exposure through headphone and earphone usage, middle ear infection, and any injury towards the ear could be the causes of childhood hearing loss. So, we are already aware of the causes of hearing loss in children. And now, here comes the most important part, which is to recognize the red flags for hearing loss in our children. Well, sometimes the signs are not too obvious and it is often unnoticed by parents. So these are the signs that the parents and everyone should look forward to when a child has hearing loss. Starting off from birth until 1 year old of age, children will exhibit immense amount of incredible growth in their first 1 year. You will witness their first smile, their first jargon of words, their first steps into becoming a fully fledged human. So there's a lot going on in the first year. So what are the signs that you should be aware in case of hearing loss after birth to 1 year old? Well, the first red flag is not responding to sudden loud sounds. For after birth until 1 year old, parents actually can look out for simple signs. Does your baby respond to sound? For example, do they startle at loud noise or turn towards your voice? The other red flag is when the child is not cooing and not babbling at all. In terms of speech, if your child is not cooing and not babbling at all, it is also a red flag for hearing loss. Our babies start to make sounds through their mouth known as cooing. It is an early vowel-like sound such as oo, e, ah, and they use it to express excitement and their emotion. By around 9 months old, your baby should start babbling by making sounds like ma, 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 da, 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 ta, ta, ta. So, if a baby is very quiet and not making these sounds, that can be an early sign that something is not right with their hearing. And then moving on to 1 to 3 years old, the toddlerhood. The first red flag that you can look forward is if the child not responding to instructions. As the child grows, we expect them to start understanding simple instruction. For example, if you say, come here, or give me the ball, they should be able to follow. And if there is no meaningful words, that is also a red flag for hearing loss. If the child doesn't respond, or their speech is delayed compared to other children their age, this is something we should not ignore. And then, if a child only uses gestures instead of words, that could be a red flag for hearing loss also. Sometimes parents will say, it's okay lah, they will talk later. But remember, hearing is very closely linked to speech. So if they cannot hear well, they cannot learn to speak and expressing their needs well. And now we are about to recognize the red flags for preschool and school age. As the child enters schooling age, the signs of hearing loss should be more noticeable to everyone. In this part, I would like to share an experience from a teacher dealing with students with hearing loss. In a bustling classroom, Sienna was always looking lost, and sometimes she did not respond when I called her name. She looked so confused and cannot answer the question I asked in class. Sienna's grades were not excellent, and she grew even more timid as the time goes by, which is unlike her at all. I also noticed some of the classmates were ignoring her in the class as she was not cooperating in group tasks. This is a good example of a story where it highlighted the impact on hearing loss that many people might have missed in the classroom. From this story, we know that children with hearing loss actually struggles in academic. This is because they often miss parts of instruction and discussion in the classroom. Over time, their language development, reading skills, and overall understanding causing them to fall behind, even if they are actually capable. Next, hearing loss can also make students appear as he or she is having behavioral problem. The child may be seen as inattentive, slow, or even disobedient, when in reality, they simply did not hear or fully understand what was said. This leads to unfair labeling and missed opportunities for early support to the child. And next, hearing loss also causes social isolation. The difficulty hearing conversation makes it hard to join in play, making friends, and responding appropriately. As a result, children may feel left out or lose confidence, which it can affect their emotional well-being. Now, we're about to continue to Sienna's story. Feeling concerned, I decided to speak to Sienna's mother. I found out that Sienna had been having an on and off ear discharge since she was in primary school. Hence, I urged her mother to take Sienna to the nearby hospital. At the hospital, Sienna underwent some tests with the audiologist and medical management from the ENT doctors. She was told to be fitted with hearing aids to help her participate better in school. Since then, Sienna's grade improved and she became more responsive. Even though she is not in my class anymore, I still see her around. Her teacher tells me that she is doing well in the classroom and I feel grateful for her recovery. So that is a teacher story. Everyone, I would like to emphasize that stories like this are real and they are not rare in our society. Children with hearing loss are often around us in our classroom and communities, sometimes unnoticed. In fact, this is something very personal to me. If you guys notice, there's a school logo in this slide. This case is actually a child with hearing loss who is currently studying in my previous alma mater 14 years ago, SMK Sri Aman. So being able to support this child and be a part of their journey is something I'm truly grateful for. It reminded me that early identification and the right support can genuinely change a child's life. And that's why conversations like this today are so important. So, what should you do if you suspect hearing loss in your child? If you not notice any of these signs, do not wait. The next step is simple. Get the child's hearing checked. So usually, what comes in mind is to refer our child to a doctor. And the person who helps with hearing is the audiologist. So the doctor will treat the medical problem such as ear infections and so, and the audiologist will test the hearing and manage the hearing loss, providing hearing aids if needed. So both ENT doctors and audiologists work together hand in hand for your child. So what should you do? First one is to notice the sign. Well, as discussed previously, it is important to notice the signs of hearing loss first. Second, seek hearing screening early. If there is any signs of hearing loss, the parents or the caregiver should seek for hearing screening early. The third one is to go to the nearest klinik kesihatan for audiology referral. You can also come to Pusat Kesihatan Prima Unimas for the hearing assessment. Our lovely staffs will arrange for the audiology referral to see me for the hearing assessment. And lastly, if your child is suspected with hearing loss, kindly follow through with the assessment and intervention done by the audiologist and ENT specialists. Of course, for a first-timer, this is what you can expect to be done to your child for hearing assessment. Well, these are some of the hearing assessment done in the hospital, audiology center, and including Pusat Kesihatan Prima Unimas. Some of the hearing tests that is done in the audiology center, hospital, and also Pusat Kesihatan Prima Unimas is tympanometry. So tympanometry is a quick, painless, and non-invasive test in order to check if your eardrum is moving properly to transmit sound. After checking the middle ear, we will check the child's hearing status. In order to do so, we will perform play audiometry. So for play audiometry, this is a hearing test for children older than 2 years old. In this test, the children will learn to engage in the activity each time they hear a test signal or test sound. So it's fairly simple activity. We will train the child to wait for the sound stimulus, and then we will tell them, oh, ada bunyi, susun Lego dekat bawah. So it's a simple test so that the child will know when there is sound, they need to put down the toys. As the child grow older and then they are able to understand instruction, we will perform pure tone audiometry. So this test is very simple as well. The child is asked to respond by pressing the signal button each time he or she can hear the test sound. So setiap kali ada bunyi, they will respond by using the signal button. But what will happen if your child is uncooperative or if you want to do hearing assessment for your baby? Then we have this another option, which is auditory brainstem response. So for auditory brainstem response, this test is done under sedation. Maksudnya, kita buat semasa anak tidur. So this test is for babies and non-cooperative child, and it can provide hearing status from the auditory brainstem without the child's cooperation. So after going through all of the hearing assessment, and if your child is detected with hearing loss, the audiologist will start on the intervention of hearing loss for your child. First, the audiologist can fit hearing aid. So hearing aid is a wearable sound amplifier to deliver the sound to your ear. So the hearing aid is fitted to your child in accordance to the types and the severity of your child's hearing loss. And remember, continuous follow-ups with the audiologist is essential in making sure that your child is receiving the amplification that he or she needs. If the hearing aid is not benefiting the child even at its most maximum, we have to go for cochlear implant. So cochlear implant is a surgically implanted electronic medical device. This is designated for people with severe to profound sensory neural hearing loss. But we only suggest for cochlear implant if the hearing aid is not helping the child at all. And there is many more intervention that can be done for the hearing loss in our children. So that concludes my sharing for today on Little Ears, Big Concern, Is My Child Hearing Well? I hope that the session today would be beneficial for all of us, especially in recognizing hearing loss in children. Do not wait and see because early action can change a child's life. Thank you.
Thank you. Thank you, Ashikin, for a very informative and also very well-delivered talk. Banyak perkara yang dapat kita belajar daripada presentation Puan Ashikin. Hearing loss can be detected early, I think, and more importantly, there's a treatment, there's a management or something that we can do to help the child develop further. Right, so there's a couple of questions here from the audience. Number one, Puan Ashikin mentioned about the hearing aid, alat
Yeah.
bantuan pendengaran. So they ask, apakah bantuan yang boleh dipohon bagi alat pendengaran sekiranya ibu bapa tidak mampu untuk membeli alat pendengaran?
Okay. Thank you for the question. So, untuk memperoleh alat bantu pendengaran, kita ada beberapa bantuan yang boleh dipohon untuk memohon alat tersebut. Sekiranya kedua ibu bapa anak adalah pegawai kerajaan, mereka boleh memohon di bawah bantuan JPA di pejabat mereka sendiri. Selain daripada itu, permohonan alat bantu pendengaran juga boleh dipohon melalui Jabatan Kebajikan Masyarakat. Jadi, tuan-tuan dan puan-puan perlu mendaftar anak untuk mendapatkan kad OKU dan seterusnya boleh memohon menggunakan bantuan Jabatan Kebajikan Masyarakat tersebut. Sekiranya JPA ataupun Jabatan Kebajikan Masyarakat tidak dapat membantu, kita ada pilihan untuk memohon tabung bantuan perubatan daripada hospital-hospital yang berdekatan. Jadi, tuan-tuan dan puan-puan jangan risau. Kita akan sentiasa berusaha untuk memastikan anak-anak tuan-tuan dan puan-puan boleh mendengar dengan baik. Okay?
Thank you, Puan Ashikin. So I think the important message is don't worry. Most importantly is come, get your child test for hearing loss. If
Yes.
there is hearing loss,
Mm.
the doctors, the audiologists will find ways to help the child to get the best hearing aid suitable for the child, right? But the first step needs to be taken. You need to bring the child for assessment. And from there, there will be people around to help the child and the parents as well, right? Okay, thank you again, Puan Ashikin, for a very, very wonderful talk. Our next speaker for today is Dr. Hanzali. Dr. Hanzali is an ENT specialist. He graduated from University Malaya. He did his postgrad there in 2021 and has been a lecturer with UNIMAS since 2014. He's currently a senior lecturer. He does clinical work in Sarawak General Hospital, teaches undergraduate medical and also nursing students as well. Today, Dr. Hanzali will be talking on common ear issues among children. Please join me in welcoming Dr. Hanzali.
Video. Okay. Sorry. Assalamualaikum and good morning, everyone. Just a bit of setting things up. Okay, to our respected viewers, thank you for joining us this morning for this short talk. So I will be talking briefly about common ear problems in children. Like Puan Ashikin has talked about before, is how to detect the early signs of hearing loss in children. So this will be a continuity of the previous topic. So for the talk, I will cover hearing loss, a bit of hearing loss in children, some basic anatomy, like the parts in the ears, and the common diseases that we see in children. So like as explained before by Puan Ashikin, so what is hearing loss? It's difficulty hearing sounds. It may affect one or both ears, can be temporary or permanent. It can be conductive or sensory neural. So we'll go into that a bit more after this. Why it matters? Basically, if in children, if you cannot hear, you won't develop speech and language. So it will affect academic performance, and when it happens a bit later in the child's life, can affect the emotional well-being of the child. So hearing loss in children, it can be congenital or acquired. Congenital means the baby is born with it. It affects about 4 in 1,000 births in Malaysia. And there are many causes, which includes infections, syndromes, such as Down syndrome that we all know, medication related, especially antibiotics, and structural deformities of the ear. Okay? And the hearing loss may be just mild, moderate, or severe. There's another classification, which is profound hearing loss. This one we have covered, so I just go through quickly. Okay, newborn, startle, reflex. Okay, the milestones for children. Okay, so at 2 to 3 months, they will turn towards sounds. They will coo. Okay, make the cute sound. Babbling at 4 to 6 months. Repetitive babbling 7 to 9 months. Meaningful words at 10 to 12 months. So the emphasis here, okay, especially we are talking about World Hearing Day, is on early diagnosis. Okay, failure to detect this may hinder normal speech development. And management is a multidisciplinary effort. So maksudnya, it's not just the ENT doctors, we have our audiologists, speech therapists, and pediatrician or pakar kanak-kanak. And sometimes we get the kids referred from the pediatrician, okay, who have detected that the children have speech delay. So speech delay can be caused by hearing loss in children. So basically, you cannot hear, you cannot speak. That's where they get the term deaf and dumb. Not a technically correct term lah. Okay. So for hearing screening, should be done by age 1 month. Okay. And if they pass the screening test, then there's no issue lah. So if they fail the screening test, they will, the infant or the baby will be given new appointments to the audiologist and the ENT clinic to further do further testing. So we should get a diagnosis by 3 months, and by 6 months we should have already have intervention done. Basically, if the child has hearing loss, then kita patut ada hearing aid, given plan for hearing aid, okay? Or if it's a profound hearing loss, sangat-sangat teruk lah, we should plan for cochlear implantation. So cochlear implantation is something that can be done by the age 1 year old, 1 year plus, okay? So the earlier, the better. Okay, so for non-scientific background people, okay, I'll just go through the basic anatomy so that we can relate a bit to what I'm going to say, talk about afterwards. Okay, so this is the basic anatomy of the ear. So basically it's divided into the outer ear. Just get my laser here. The outer ear, middle ear. Okay, so the middle ear is after the eardrum. It contains the small bones of hearing. We call it the ossicles. And then the inner ear. So the inner ear contains the nerves which transmits the sound. It changes the sound to electrical signals to our brain. Okay, so our brain detects all these sound waves as sound. So what are the common problems? Basically infections. Otitis externa, otitis media, those are mostly infections. Barotrauma. Barotrauma is basically the issues that children get when they go up the plane, okay, travel in the plane. You see the baby cry. That is barotrauma. I will explain a bit more on that later. Foreign body, earwax buildup, ruptured eardrum trauma. So when we get the question, my child is not hearing well, what can it be? We have to check your child. So what is the age of the child? Okay, have they done newborn hearing screening? Okay, and then we have to physically check. Okay, it can be a lot of things. So the picture is one of our the audiology booths in SGH. Okay. So congenital hearing loss. Okay, one of the causes for hearing loss in children. This picture shows microtia. So microtia means deformity of the outer ear. There is a spectrum. This is a spectrum of disease. Some may have absent ear canal. Okay, basically the lubang telinga is also absent. Some people have only mildly deformed ears. Okay, one ear just smaller than the other. And some more severe disease, the bones of the middle ear may be absent as well. Okay. So if it's quite a severe disease, we can help them with surgery, or we can help with providing hearing aids if they don't want surgery. So next is middle ear effusion. So middle ear effusion is where you get a fluid buildup in the middle ear. So it's behind the eardrum. So it's not like, it's different from when water enters your ear when swimming or showering, okay? So when water enters your ear, it would not lead to this. This is associated with upper respiratory tract infections, like the common flu, cough and cold, okay, or barotrauma. Barotrauma meaning you go up the altitude, okay, scuba divers, you travel on the plane, okay. It may take a few weeks to a few months to recover. Okay. So how do we address this problem? Here we put in a grommet. If it doesn't resolve with medications, here we put the grommet in the ear. So this picture here is a blown up picture of the eardrum. Okay, so the real size is like this. Okay, it's about 1 millimeter, very small. Next is infected wax. Okay, so some people like get grossed out by this, but it's our normal bodily function. The wax is to basically to trap all the dust, okay, and then bring it up, bring it out of the ear. Actually, there are actually many different types of earwax, from the wet type to the dry type. Okay. But what are we not supposed to do is don't use cotton buds, okay, because the cotton buds will actually just push in the wax, okay, and after some time it will compact the earwax, making it harder to come out. Okay. Actually, our body has its own mechanism to bring out the earwax. Okay, so the safest way, if it's not so severe, okay, you don't want to see a doctor, okay, you can try olive oil. It can be used as a wax softener. It will soften and drain out the wax slowly. There are also a few pharmacy products that you can buy over the counter, serum, all those things. Okay, wax softeners, you can ask for wax softeners from the pharmacies. So for the picture below, syringing, this is when the wax is quite difficult to come out, okay? And here is what we use in the ENT clinic, is all these suctioning devices, okay? And it must be done by experienced medical personnel. So that is hearing loss. So about pain in the ear. So why am I talking about pain in the ear? So pain in the ear can be caused by many things also. Otitis externa, otitis meaning infection. Otitis media, which is infection of the middle ear. Foreign bodies, trauma. So this pain is can be associated with hearing loss. Okay, pain and loss of hearing, it comes together. So in kids, children, if they haven't learned how to talk yet, okay, we can look for other signs. So for infection, it's ear tugging, okay, they will tug the ear like that, okay. You look for ear discharge. The ear discharge meaning fluid coming out of the ear. Okay. Hearing loss. How do you detect hearing loss? Like the Puan Ashikin mentioned before, the milestones. Okay, if they are babies, you look for the startle reflex. If it's absent, it could be that there is already hearing loss. Okay, irritability. If they have fever. Okay, if it's associated with infection, they have discomfort in the ear. You know, they cannot really say that sakit telinga. Okay, they will be just irritable. Okay, merintah lah. Okay. Okay, some may signal minor or non-serious disease. Mostly it's minor problem, minor infection. While some signs can point to more serious problems. Okay, serious meaning can lead to severe infection, life-threatening infection. So for example, this. Okay, this is swelling behind the ear. Anyone see this? Okay, in their children or in other people's children, please advise them to go to the hospital immediately. This is a sign of severe ear infection. Okay, this could be a sign of pus collection, nanah, okay, at the bone area behind the ear. So this is otitis externa. Otitis externa is infection of the outer ear. Okay, if you remember the slide I showed before, outer ear, middle ear, inner ear. So outer ear is bahagian telinga luar. So the disease classically will have pain, ear discharge, and you see if this exudates or this all this kekotoran blocks the ear, they may have hearing loss. Okay, so if the patient comes to our clinic, we will treat with antibiotic ear drops. It usually settles, okay, And this one may be caused by excessive use of cotton buds, okay? Not just cotton buds, the metal, even the metal scraper, okay, the metal wax remover is worse, okay, because it can cause abrasions in the ear. Okay, with the abrasion will be a entry point for bacteria. Okay, so please don't use cotton bud or metal wax removers. Just use the wax softeners or wax eardrops. This is acute otitis media, which is infection of the middle ear. So with the infection of the middle ear, there will be fluid in the middle ear, which will cause hearing loss. Okay, so the hearing loss will feel like the person always describes that there's feel like the water in the ear. So macam they go swimming or showering and the water enter, okay, they cannot get it out. It feels like that. So with this one takes longer to resolve, okay. So in kids, it happens more often because of this tube. This tube, which connects the middle ear here to the back of the nose. Okay, they are shorter, narrower, and more horizontal in adults. So it's prone for blockage because this tube function is to equalize the pressure of the middle ear and the outer ear. Next one is barotrauma. So if you remember the tube, okay, the tube equalizes the pressure. This is the middle ear pressure. This is the outer ear. So why do babies cry when they go on the plane? Okay, because of pain. Okay, it's not because of the noise of the plane or anything, because they get pain. So when the pressure, there is a pressure difference between the middle ear and the external ear, there will be stretching or distension of the eardrum. So the stretching causes the pain. So what can we do? So you give pacifier, okay, pipette, okay, bottle feed. In bigger kids, you ask them to suck on candy or yawn. Okay. Or you can buy child-safe decongestants. Okay, just before the flight, give them decongestants. So this one, if severe enough, this barotrauma, it can cause a rupture of the tympanic membrane. Okay. So this one happens in divers as well, but divers usually are not kids. Okay, they can equalize usually. This is very common in kids. Okay, may happen in adults as well, unfortunately. So in children, it's usually the parents will notice that the child macam susah sikit. When you call them, they don't pay attention, or their response is lambat. Okay. Then when you check, there's a foreign body blocking the external ear. In bigger children, older children, we can remove this in clinic, but in younger children yang macam maybe 1, 2 years old, 3 years old even, we may need to bring them to operation theater, okay, just to remove this, because we don't want the ear to bleed. So in kids, it's usually foreign objects, okay? Either the kid put it themselves or is inserted by another or the child's friend. Okay, this is another one or gross. Okay, it's a insect in the ear. So that's all. Okay. So our take-home message: screening. Okay, the hospital has already put in place a screening program. Okay, all newborns must have hearing testing done. Okay, but even then, we'll need parents, the parents to be alert on their child, because hearing loss can happen at any time. Okay, so to be alert if the child responds a bit later, okay, lebih susah to panggil. We need more public awareness, okay, about the hearing screening as well, because even when the screening test failed, some parents do not come back to hospital for their follow-up, okay, for the hearing test. If unsure, always get professional advice. Okay, thank you very much.
Right. Thank you, Dr. Hanzali. Very, very informative talk as well. We learn a lot of things. So there are like presentation other than hearing loss in children, right? Not only hearing loss, you can have ear pain, ear discomfort as well. All this can also lead to hearing loss. So like Dr. Hanzali mentioned, if you're not sure, do seek professional help, either in the clinics or in the hospital. So one of the common questions that we always get, Dr. Hanzali, is how do parents prevent the child from getting infections of the ear? Any advices for that?
So to prevent infection, it's some is lucky draw. Okay. So sometimes you cannot prevent infections, but what can parents do? Okay, it's basically what I what I mentioned just now. Cotton buds, and the metallic wax remover. That is the most common culprit that we see. Just to explain further, because even the cotton buds, it looks soft, okay, but the skin of the outside ear is very thin actually and very sensitive. So even the cotton buds can cause like small abrasion, and this abrasion may develop into infection later on. And then, yeah, for the middle ear infections, it's a bit harder, okay, because it is usually related to the cough and cold and flu infections. It's more common in kids who go to daycare or TASCA. Okay, once you have a flu or cough and cold going on there, the infection will spread quite quickly. Okay, in some kids, the cough and cold, the infection spreads to the ear. Okay, so one way to reduce like this infection is to reduce exposure to sick people. Yeah, but otherwise it's really hard to stop it.
I see. Okay, Dr. Hanzali. You mentioned earlier that even something as soft as a cotton bud can cause injury to the outer ear, right? So there's a question from the audience. They were asking, how do you suggest parents to the safest way for parents to remove the dry earwax in their children's ear?
To remove the wax. Okay,
Yeah.
that is a very common question we get as well from the clinic. Okay, after we tell the parents that don't use cotton bud. Okay, if you don't use cotton bud, what do we use? Okay, one way is after after shower. Okay, we can use the corner of the towel. Okay, just to wipe the outside of the ear, because the ear already has a mechanism of bringing the wax slowly from the inside to the outside, but very slowly lah. Okay, sometimes if the parents can see from outside that the ear there's too much wax, okay, and he or she, the father or mother is worried, they can go to the pharmacy and buy the eardrops to soften the wax and drain the wax. Okay, there are a lot of brands from the pharmacy. You can just ask the pharmacist, so which eardrops are used to remove your wax. Yeah, it usually takes some time. Okay, 1 week, okay, 2 weeks to clear out the ear. If it's still not clear, or you're worried, okay, that the child might have hearing loss because of this, you can always bring to our clinic, okay, which we have ENT clinic in Prima, promotion sikit lah. Prima and audiologist, our audiologist is also doing hearing tests dekat clinic Prima.
Right. So like, because both Dr. Hanzali and I we are the ENT clinic. So we do see a lot of, the reason why we have such a concern about this is because we do see a lot of kids coming in with ear injury after the parents try to clean their ear with cotton buds, and sometimes they use the metal sticks as well, right? So you can't actually visualize the ear properly, and it might actually cause some injury, right? So there's another question from the audience. This a bit for the adult as well. What is your opinion on gradual hearing loss, which the patient noticed after having the COVID-19 vaccination?
Oh, this is a tough question.
Yeah.
Yeah, this is a very tough question. Okay. COVID vaccine is, I mean, it's still a bit controversial. Not the COVID vaccine itself, the diseases which happens after COVID vaccine. Okay. So the only thing that I mean, that is associated and not really proven, but is highly associated with disease is the I forgot which vaccine it is, but I think it's the Chinese one. The Chinese vaccine is associated with the heart disease. So that is the only thing that we can comment on actually. But for other problems, okay, such as hearing loss, other diseases which flares up, it's very difficult to prove. Okay, sometimes it's just coincidental, because we do actually have some other diseases which happen after COVID, but it's not really proven. I mean, even in the scientific literature, we cannot really prove it.
Okay. All right. Thank you, Dr. Hazali, for the sharing. So we will move back to Puan Ashikin, who will give us the closing remarks. Let's welcome again Puan Ashikin.
Hi everyone. So I'm back. This time for the closing remark for our event today. I would like to share just a few of the take-home messages before we end our webinar today. So if you are worried about your child's hearing, please do not wait. See an audiologist early. So first, do not ignore the signs. Sometimes they are very subtle, but they matter. So trust your instincts as the parents and also the educators. Second, early detection changes lives. So the earlier we act, the more we can support a child's speech, learning, and their confidence. And finally, every child deserves to hear and learn. Not just to listen, but to connect, to grow, and to fully experience the world around them. So if you are ever worried about your child's hearing, please do not wait, because one early step can make a lifetime of difference. So I would like to thank you for taking the time to be here today, for caring, and for being the part of this important conversation. So we will continue to Dr. Kevin.
Right, thank you. So once again, thank you everyone, to our speakers, to the audience for being here today. And I hope we actually gain some knowledge, we raise some awareness, not only among the audience. Hopefully the audience will also spread this awareness to their friends and to their family members. All right, so before we end, we'll just share the Unimas QR code again for those of you who just joined to get the attendance. Once again, for those audiences who are not from Unimas, please fill in the link in the chat group. And we will also share the MMA QR code. This is for those doctors to claim the CPD points. So just give us a few minutes to put up the QR codes. We'll leave it on for probably about 5 to 10 minutes, giving time for you guys to actually fill it. Right? So thank you once again. Hope to see you guys all again soon in our future webinars. Take care and have a nice and good Monday. Bye-bye.